So today we're really talking about this relationship being defined in 5 specific areas. And that's the essence of what we're committing to together and what the signing is about. The first is something that I have to compliment the minister on, which I think is just brilliant, which is something he's been introducing across the United States. And we are amongst the very first health systems in the country to make this commitment, which is this concept of code care. And code care is creating a vehicle for our nurses to go back to Jamaica. We are going to use our Center for Education, Simulation, Innovation and the platform that we've created to train people in Jamaica virtually. So people don't have to leave the island. They can get access to our expertise here because we have the technology and the capabilities to do it exceptionally well. And on occasion, where it merits it, because of the technology and the resources that exist within our center, we'll bring people from Jamaica here to get that level of training for very intensified, brief periods of time.
I think the experience that we have had through COVID has taught us that COVID has been a great equalizer. No matter where you're from, no matter your race, your color, your creed, your social status, at some point in our lives, those of us who have survived COVID would have had some levels of fear and uncertainty about what the COVID virus would have done to us, our families, our communities, and indeed our institutions, because it cut across socioeconomic lines. It was important for us to take a perspective that would seek to strengthen the partnerships that exist and forge new partnerships based on the reach that we have in places like North America and here at Hartford. And that's what we sought to do. Over the last 3-4 years, nearly 3,000 healthcare workers, in particular nurses, have migrated, left Jamaica. 75% of them to the United States, some in this room maybe, others to other parts of the world. In the past, we have viewed that in a way that is maybe not the right term, but it's almost antagonistic. Competition. We're losing our people to greener pastures, maybe the right terminology, better economic prospects, better working conditions, and so on. There's no argument there. For me and for the team that I lead, we have tried to take a different perspective, particularly coming out of COVID. We have said, listen, we believe in the mobility of labor. We think people should exercise the right to engage where they think the best opportunities are for them. But we also know that Jamaica, that unique dot in the Caribbean, has a special place for every single Jamaican. And indeed, every single non-Jamaican who has met a Jamaican. That applies to you too, Jeff, right? And so the opportunity for us is, how do we capitalize on that? Separate and apart from the fundamentals of the One Health approach, where we rise or we fall together, no matter where we are in the world. And I think out of that, the code care concept emerged, where we basically have said our limitation in Jamaica is that we do not have sufficient faculty to teach. We don't have clinical rotation space. We certainly don't have the simulation rooms that you have, where I see mannequins bleeding literally. We have not gotten to that stage yet. And we do have a backlog because we had to prioritize during COVID. And so about 6,000 Jamaicans who may not die immediately are suffering because they have a hernia that they need to take care of, fibroids, and I could go on. And so the idea of code care was, instead of complaining about the lack of staff or can't being able to train, why don't we combine our efforts and find a way to ensure that we both benefit?